Sounds good. Thanks, Veronica. Doctors say the COVID fatigue mentality continues to set in across the country, especially when it comes to staying up to date on vaccines. The CDC reports about 67% of Americans eligible for a vaccine have gotten the entire primary series, and just under half of those people have gotten the first booster. It dwindles more for the second booster, for which people 50 and older or immunocompromised are eligible. That percentage is roughly 26%. Public health scientist Jessica Steer says in the short term, not getting boosted puts a person at greater risk of infection or reinfection. In the long run, she says staying up to date with booster shots impacts long COVID.
We're seeing that the vaccines and the boosters are preventing that. And then if you have long COVID, they do help resolve some of those symptoms.
Dr. Larry Bush, an immunologist who's worked extensively on COVID vaccine trials, says another long-term effect to consider is getting boosted moves everyone closer to a true endemic stage.
The more the virus gets to replicate in a person as it's active, the more chance of a variant that may be very aggressive or that the vaccines have no effect on.
Last week, an FDA panel voted to recommend modifying COVID booster shots in hopes of offering protection from newer variants and having updated boosters in the fall.